from the College by the Lake, Coeur d'Alene, Idaho. Local, regional, national, and international guests discussing the issues and topics affecting the way you live are on Forum, the North Idaho College Public Forum, with your host and moderator, political scientist Tony Stewart.
One of the most important issues that faces every person in this country or even other countries is dealing with health care and its management. And all of you viewers know, of course, that the kind of health coverage that you have, particularly addressing major medical expenses, is vital to you and can result in even bankruptcy if you don't have the right kind of coverage. And there are many Americans who do not have health coverage. And so what we decided to do on this program today is to discuss this extremely important question, and there's been many national and regional debates. We're very fortunate to have on our program today the Insurance Commissioner for the state of Washington. I welcome to the program Commissioner Deborah Seen, who is serving her second term in that state. And we're delighted that she could come and be on our program here at North Idaho College. Our guest is highly qualified to serve in the position she holds. She has a baccalaureate degree in the field of history from the University of Illinois. She also has a master's degree in political science from the University of Illinois and holds a law degree from Loyola University. And as I indicated, she is in an elected position and has been elected twice by the people of the state of Washington. Commissioner Seen, welcome to our program. It's a pleasure to have you here. I know you have a busy schedule today, and you're kind to take time to talk to the viewers, not only in eastern Washington, but the entire area that we cover. And the kind of things you do is helpful to viewers in all of those states. If I may start with just an introductory question, would you give our viewers your idea or belief, before we get into some of the special projects you have, the significance of health care coverage and insurance coverage?
Well, first of all, thank you very much for inviting me to be here today. Health care and health insurance is an issue that doesn't go away. You know, in the 1992 election, it was very much on the top of voters' lists, and then it sort of went away for a while, and now it's back. The simple reason is that health insurance and health care coverage, access to affordable, good quality health care, is something that affects every family in the Northwest, every family in this country. So this is something that the Office of the Insurance Commissioner pays attention to. That's one of the reasons that we were created, to oversee the health insurance industry. And we are committed to making sure that people have access to health care and try in every way we can to make it affordable.
First of all, I would back up to say that obviously your office deals with some other issues, but we invite you here today to deal with this particular very important question. The second question that I would have has to do with, again in a very general way, we go from what I would describe as two extremes, and you can correct me if you don't agree, of course, from individuals who have no coverage at all, to individuals like senior citizens that sometimes, in addition to their Medicare and the secondary insurance, they're often convinced to have additional policies they don't need. Would you describe for our viewers what would be proper and adequate care? And I know it varies depending on age and number in the family and so forth, but what should a family look for to have the proper coverage?
Well, a family, in fact, you brought up the subject of our brochure that we're here talking about. We have a brochure called Navigating Managed Care, which we've been talking about. And in this brochure, we answer some of the most commonly asked questions about managed care. We tell a family how to assess their needs when picking a plan and explain the system to them. So the question you asked me is obviously a complex one because it depends on the needs of the family, the health needs of the family, what's affordable. Obviously, the biggest barrier to health insurance coverage is affordability. A lot of people are uninsured simply because they can't afford it. So those are some of the issues, and so it's more individualized in terms of what a family's needs are. But we have put together a brochure that begins to address those needs.
Let's go into that. I know that I have looked over your publication, and again, we showed it to the audience, and I'll show it again to them because certainly people in the state of Washington can get a copy of this, and that's what it's for. And before we go off the air, we'll give them a telephone number if we may to do that. But in this navigating of managed care, would you start by telling us almost like a point system of some of the things that they should look for and some of the things that are provided in this pamphlet the kind of questions that you should pursue and get answers to before you make a decision, even on all the coverage that you would subscribe to?
Well, absolutely. First of all, one of the biggest issues in healthcare is choice of doctor.
Yes.
And as you know, Tony, managed care now is pretty much what's in the marketplace for health insurance. And for purposes of your viewers, let me try to define managed care.
Sure.
And in our office, we say if you pick a doctor off a list, in other words, you send a pamphlet by your insurance company and you have to pick your doctor off the list, you're in a managed care plan. Now, some managed care plans are more restrictive than others. In other words, you have to go through a primary care physician, and he or she has to make a referral in order to go on to a specialist, and that's more like the group health model. It is a tighter managed care system. But in fact, if you just pick your doctor off a list, then that's managed care. Mm-hmm. So, as I said, one of the biggest issues of choice of doctor, so one of the first things you want to do is see if the doctor that you want to go to is on the list, is in the plan. Second of all, of course, as I mentioned before, we talk about rates, and the question is whether or not the plan is affordable. One way that you can adjust the cost of your plan is determining whether or not you want a higher or lower deductible. You know that a number of people, young, healthy people, often buy high deductible plans, and they have to pay out a certain amount of money before coverage kicks in.
But the premiums are lower.
But the premiums tend to be lower. But it's very interesting because, you know, we hear this all the time, but if a young, healthy person is in a car accident, the next thing we know, they need the healthcare system. Right. So that's just one way to adjust your premium, and you have to see if it suits your family's needs. Next, you have to look for the types of benefits that are in the plan. And actually, in our guide, we have a little a pocket part, and I'll show you this as you open it up. You'll see there's another guide, a smaller guide, and in that guide we have done some collection of data, comparisons with the plans to see how they stack up against each other and to give the consumer an idea of what he or she is looking for. In fact, we always say a well-informed consumer is a well-armed consumer at the Office of the Insurance Commissioner. So, for example, in our guide we have a rates comparison chart. We also have a chart listing some of the most asked about benefits that carriers offer. For example, we've got the carriers listed on one side, and then we've got maternity coverage, prescription drug benefits, wellness and prevention, rehabilitation therapy, and mental health. So if you need any of those types of coverage, you should look to see if they're covered, because those are the areas of exclusion. In fact, one of the biggest ones we hear about is prescription drug benefits. People want coverage for their medicines.
Mental health oftentimes too, isn't it?
Yes, mental health is a big one, and fewer and fewer employers are buying mental health coverage, and so you need to look in a plan to see if it's in there. So those you want to do. The other thing is that if on this issue of doctors, a number of plans have something called a point of service option. And that means you can go outside that list and go to a doctor, but you pay a little bit more. And so we have a chart that explains that. We explain that in our brochure, and it tells you what you have to pay to go outside the network. A higher coinsurance, which is a percentage of your insurance payment, or the cost, I'm sorry, of that visit, or a copay, which is basically a flat fee that you pay when you go to the plan when you go to a doctor.
If I can just interrupt for a second.
Yeah, go ahead.
What that is so important about too, that depending on the kind of illness you have, by having your chart, then you can make a decision in each case whether or not that would be financially what you want to do.
Absolutely. Absolutely. I mean, for some people, paying a little bit more to go to the doctor of their choice is absolutely the number one issue. For other people, it is a certain type of benefit. I cannot tell you how many times I meet a family who has, for example, a family member has diabetes. And I'm asked the question, you know, are the strips, are the syringes, are the things related to insulin covered? And so it depends on what your family's needs are.
Why don't you go ahead, I interrupted, but I'll go ahead and tell them about some of the other advantages. I looked at your program and I see the companies listed, and then something that seems to me that's very, very helpful is what is the deductible, and what are the prices, premiums per month or over the year. This is really a shopping guide, as you've indicated.
Yes, it is. In fact, this is one of the first shopping guides of its type here in the state of Washington. And in fact, we've had 3 printings in a week and a half. We have had over 6,000 phone calls to the Office of the Insurance Commissioner. And I know you mentioned you're going to put up the number. I'll mention it quickly. It's 1-800 I'm sorry, it's slipped my mind. You've got it right there.
I've got a number here. I've got 586-4422, but that's not the 800 number, is it?
No. That's not the number. Let me get it out
for
you.
We'll get that and go ahead and look at.
I was talking to someone the other day, and she said she was having a forgetful moment. I apologize for forgetting the number, which I say so often.
Yeah, right. And if they can't, they can obviously call your office and get that number. But we'll come. You can look for us what's going on. Because I didn't have it on a particular page I had here.
Here it is. It's 1-800-562-6900.
I'm going to give that again because I know people are going to call in, and I will wait a minute, and if they get a pencil and a piece of paper, some people are running to get that right now, then we will give them that 800 number again. Also, in addition to premium prices and benefits covered and so forth, you have in here too other things to be aware of as you shop. Would you share with them, can they come in and out of certain plans, or are there certain laws in Washington that give more flexibility? I know there's a lot that's being done at different state level rather than a national policy of regulation.
Well, as you know, in the state of Washington, we have some of the most forward-looking laws with regard to access. So people should know that if they're in a plan and they change jobs, just because they had gone to the doctor or been in the hospital or utilized, that's the term, they don't lose their coverage. Also, there's a 3-month waiting period for anything for which you were treated 3 months prior to enrollment if you're a new enrollee, and that's a short waiting period, and that really has allowed access to people in the state of Washington. I know that when we had public hearings here several years ago on this issue, a member of the Spokane business community, Mr. Marsh, had come forward and said that he'd worked all his life and paid for insurance, and then he had a heart condition and he couldn't get into any plan. So we have adopted a law in this state which allows people access and who are not shut out because they're sick.
And without that, some people went for years without it, even though they'd paid for years. That once the illness had taken place, or they changed jobs or changed insurance.
Absolutely. In fact, people were dropped after they would change jobs, and this was an opportunity to exclude them from the plan because they had been sick and made a claim.
Let's talk a little bit about the difference between being in a plan that's at work, in a corporation or institution, where you have a group plan, versus individuals who have a small business, self-employed, or for whatever reason at their work they're not covered. There's a tremendous difference in the prices of premiums if you're in group insurance versus individual purchase. But don't you also have some provisions in the state of Washington that give some relief to individuals who have to buy their own insurance that's similar to a group plan?
Well, you know, once again, you have access. And really, the major difference between group plans and individual is that group plans have a better negotiating power.
Right.
And as a result, very often a broker will be able to negotiate away some of the exclusions that would be applied to an individual. So that is really the big difference between group and individual plans. The market does sell individual plans. We do have, the state of Washington does have a subsidized plan known as the Basic Health Plan.
Yes.
But you have to be 200% below the federal poverty level, but that plan is available, and it's a very good plan. And of course, there is Healthy Options, which is the Medicaid plan out in the marketplace as well. Although there's some changes here in the state of Washington and in Spokane on Healthy Options that were just announced recently.
What if you join a company and you want to go into their group health plan? It's a managed plan, and you have a family physician you've had for years, but that's it's more restrictive and they're not on the list. Is there anything you can do about that other than what you've talked about, some options where it might cost more? Does a company have to allow that option, or can they restrict you solely to the list?
No, they can restrict you. I mean, what happens so often, because people do get their health insurance through their employers, is that whatever the employers select, that is the plan that they have to choose. For example, in Seattle, it used to be that employers would choose one of the plans, and one of the largest plans ultimately had about 95% of the doctors in its plan. But that is a disadvantage, and if an employer selects a plan and that's the one you're restricted to, unless there's the option to go outside of network and pay a little more, you'll be restricted to that list.
Something else that you've done, you have another publication. I want to commend you, first of all, Commissioner, for working so hard on this and making this available to the public. But I have here also a copy of your Medicare choices. Again, senior citizens have a lot of different access with what Medicare covers, and then having a secondary policy. Would you take us a little bit through the purpose of this particular publication?
Sure. This actually is hot off the press. We just finished printing this just a few days ago. In about a month, the federal government is going to announce some major new changes in Medicare, or some new options that are being offered.
We're taping this in October, so by the time it airs, it will have taken place.
Oh, okay. Well, actually, it will just be in several weeks.
Yes.
I'll give the date. It actually will be November 4th when they make these announcements. And some of these options will not even be offered in the state of Washington at this point. So we put together this brochure to explain to seniors what the new offerings would be, but also to explain the system as well, because managed care has impacted Medicare. We have Medicare managed care plans now. But here's the single most important message that I can give to seniors who are listening today, and that is, if you like the plan you have, don't do anything. There have been huge changes in the health insurance market over the last several years, and particularly for seniors. I myself have an elderly mother. She's 83 years old. Particularly for seniors, it's very, very confusing. They're trying to cope with illness and at the same time hear about all these changes in the system. And so if you like what you have, don't change a thing. Keep what you have. Now, we also have very actively in the state of Washington something called the SHIBA program, which is Senior Health Insurance Benefits Advisors. And they also have a 800 number, which I have right here. I won't forget it. It's 1-800-397-4422. And that is a number that they can call if they have specific questions about Medicare, Medicare supplement, Medicare managed care, or long-term care.
I'm going to also take this opportunity while they're writing down to give your number again on all this information. Again, it's 1-800-562-6900 or 6900, and your staff's there to answer their questions. Another question on Medicare. I know it's complicated and the rules that seem to continue to multiply, but basically on major health care coverage, or maybe a very major surgery, for example, Medicare generally and basically, is it correct to say that it would cover approximately 80% of the expenses of if it's major medical?
On Medicare?
Mm-hmm.
Well, usually it depends. You have to buy a Medicare supplement plan, and then that covers the portion which is not covered. So that's about right. For example, my own mother, we have a Medicare supplement plan, and she pays very, very little because the extender or supplement plan covers that which Medicare does not pay for. What's different about Medicare managed care is the fact that they roll the whole plan in together, and so you don't have to buy a Medicare supplement product. But sometimes that restricts your choice of doctor. The one thing about having Medicare and buying a Medicare supplement, you can always pick your own doctor, and so that's one of the big differences.
There's more freedom there.
Yes.
You don't want that. I would suspect too, senior citizens more than any other portion of the population would be very much locked into a doctor that maybe has served them for a while and really knows if they're likely to have more illnesses, what that might be.
Absolutely. We hear about that. In fact, once again, in healthcare, the single biggest issue is choice of doctor. And that's why at the Office of the Insurance Commissioner, we're really committed to helping people have access to the doctor which they choose.
Commissioner, time has moved along. You've been so helpful. Now, I do want to get into an area that to get you to react to with your expertise. We hear a lot on national programs, 60 Minutes or 2020 and others, about managed care. And there's been some at least case studies where there's even some lawsuits now that saying that care was denied an individual. They were not referred from a physician to a specialist or to surgery, and cases like cancer and so forth, and death took place. To what extent is that a problem, and do we need any corrective legislation, either national or state? Are those legitimate concerns that we find around the country?
Well, you know, at this point, there's been no progress on the Patients' Bill of Rights in Congress. And we've had a number of bills on managed care protecting patients in the state of Washington that have failed to pass. They have been killed by the insurance industry in this last legislature. So it is a very big concern. At the Office of the Insurance Commissioner, we are adopting certain rules and regulations to deal with some of the issues around managed care that we hear about. For example, I had a meeting about 3 months ago with emergency room doctors in the state of Washington about failure to cover emergency services, which normally should be covered at any emergency room. We hear about cuts in benefits. We hear about the revocation of a prior approval. You get your doctor calls the insurer, they agree to pay for a surgery, he performs the surgery, and the next thing you know, they don't want to pay for it. So those are the types of problems that we've heard about. As a result, we are passing rules in the Office of the Insurance Commissioner, or adopting rules, shall I say, in the Office of the Insurance Commissioner, related to grievance procedures. Is there a way for someone to air their grievance in an insurance plan? Rules related to making sure that we have the provider lists on file and they're kept in order so that you can find out if your doctor is in the plan. You know, there's a managed care joke on the internet that says, I just joined a new HMO, how difficult will it be to choose my doctor? And the answer, about as difficult as choosing your parents. And the reason, and then the joke goes on to say that you'll either find the doctor in the plan and he won't have time to see you, or he'll have time to see you and he's no longer in the plan. People have told us over and over, we joined a plan because of a particular doctor, he's no longer in the plan. So we're requiring the companies to file that information with us so it's kept in order, up to date, and consumers have access to it. And finally, we're adopting rules to make sure that there are enough doctors in the plan to serve you. We have a plan in Eastern Washington that only has 4 doctors in the network. One's a specialist and the other 2 are pathologists. And so that really is not enough doctors to serve the needs of that community.
It's impossible, isn't it? So that's the kind of thing that both in the information that you're filing in your office and also in these pamphlets, that every person should look at before they, if they have that option and they're going into a plan.
Absolutely.
You've indicated that there's more legislation needed and it's very difficult to get at the state level or at the national level. Under present law in the state of Washington, how much authority do you as the insurance commissioner and your office have to either require insurance companies to do certain things or to at least try to be persuasive with your contacts?
Well, we do have a great deal of authority to protect the public. That's the job of the Office of the Insurance Commissioner, is to protect the public with this important issue of insurance. We have aggressively started in enforcement cases. We're making sure that the insurers conduct themselves according to the law in the marketplace. But as the system changes and we get this new managed care, often we need more authority and ability to protect consumers. And so that's why, for example, last session, one of the bills that was killed by the industry had to do with a grievance process that was external to the insurance company. In other words, and they've passed this in a number of states, to take the process of a grievance outside the company because they're so economically invested in the medical decision. We want to make sure that doctors make medical decisions and not accountants or insurance company executives. And that's a very big issue now with one of the big plans in the state having to do with the contract that they're writing with the doctors. They're taking some of the authority away from the doctors. We want doctors to be able to treat their patients and not feel pressured or told to deny treatment for economic reasons.
But it is helpful to your office if individuals feel that there is something unusual going on or decisions that might be in violation of the rules and policies, that they can provide that information to your office.
Yes, actually we have consumer compliance officers, and they answer questions on our consumer hotline, which is 1-800-562-6900, and they'll answer your questions. And we have something in the office called the squawk factor, which is if the Office of the Insurance Commissioner is brought into a problem, the chances of it getting resolved in favor of the consumer are much, much higher.
So that you're creating some policing from the sense of that they know that there's questions that are going to be pursued about what is happening. Back to the, and we're running short on time, but back to the Bill of Rights for patients. If that was to be passed in the state of Washington or nationally, other than what you've already mentioned, what would that do to make the process work so much better? Well,
it's very important that there be consumer protections because managed care plans are trying so hard now to save dollars. The really big issue in healthcare is we do not want to save money by reducing the quality of our healthcare. And what the Patient Bill of Rights would do, or these types of laws, would give consumers some protections to make sure that they got treated by their doctor in a way that is medically necessary and not economically necessary for the insurance company. So those are some of the issues involved, and this is very important for consumers. And finally, let me just say that since consumers need to be advocates, that's why we've put together these brochures, Navigating Managed Care, so the consumers can be their own best advocates.
And with those right kind of questions, it'll affect what they get in the plan, and once they're in there, oftentimes they can require them to live up to the policy by knowing what their rights are. I wish we had another 30 minutes to interview Commissioner Seen. It's been a very informative thing, and I'd like to invite you to come back at some future date as you develop this and share with particularly your people in Eastern Washington what you're doing. And I, on behalf of our staff, thank you very much for being with us today.
Thank you.
Ladies and gentlemen, our guest has been Commissioner Deborah Seen, who is the Insurance Commissioner of the State of Washington, and her new publications, which are a guide for you in dealing with your future in health care. I know you found this program extremely informative for you, and again, I would mention the number is 800-562-6900 for further questions that we could not deal with on the program in her office in Olympia. Please join us again next week when we'll discuss yet another issue. Until then, please have a good week. I am Tony Stewart.
The North Idaho College Public Forum was videotaped live from the studios of Instructional Technology on the campus of North Idaho College for viewing at this more appropriate time. We invite you to join us again next week for another all-new edition of the North Idaho College Public Forum on this public television station.